In early February, the provincial government announced an overhaul of how it manages programs and services for children with autism, and it's been headline news ever since. Here to explore the plan and what's made it so controversial, Margaret Spolstra. She is Executive Director of Autism Ontario. Tracy Lindblad, Clinical Director of Monarch House, a private treatment centre for individuals with developmental disabilities, including autism. Anne Borden, co-founder of Autistics for Autistics Ontario, and two parents of children on the autism spectrum, Hannas Rasmussen and Azed Majid, and we are delighted to welcome everybody around our table tonight here at TVO. Let's just, because there is so much background that people need to know to get ready for our discussion. Sheldon, if you would, let's bring these graphics up just to get people up to scratch. There are 23,000 children on wait lists for autism services, 2,400 families waiting for diagnostic assessment, and the average wait time for that assessment is 31 weeks. These figures from the Government of Ontario. Now, what's new? There is a promise to double funding to diagnostic hubs to clear these wait lists. There will be a childhood budget until age 18 of up to $140,000. There's a target of 18 months to clear the existing wait list. And the government also promises to create an independent agency. In the meantime, however, Autism Ontario, Mark, that's you, I guess, will help families navigate the new system. Okay, that's some of what is on offer right now. Let's start with this. Mark, how does this plan differ from what Ontario families had before under the Liberal government?
Right, so the changes that were announced are a shift, I would say, is the decision about this direction is more of a fiscal one than looking at the evidence specifically. And so before, the families were receiving an opportunity to have their child's needs assessed and then base the funding on what those needs were. So the difference is now that may not necessarily be the path that families go down, because now the funding will be placed in their hands in order to make choices about services with far less money than would be necessarily assessed for an individual child.
Sure, and when people say choice usually sounds like a good thing. Is that the case here?
It may be for some families, and it depends on the child's need. So I think that's at the heart of this. But what we do know is that it's not a choice if what your assessed child's needs are for this particular therapy are many, many more hours than what the funding will allow for, then your child's not getting what they need, and that's not really a choice.
Gotcha. We did invite Minister Lisa MacLeod, who is responsible for this file, to be on the program. She declined. Her parliamentary assistant, Amy Fee, was also invited to come on. She also declined. Here's what the statement that Minister MacLeod had sent along, though. Under the old system, the parents of 3 out of every 4 children were paying out of pocket to support their child. Stuck on a wait list with no end in sight, families had no idea how they could plan for the future. With our childhood budget, families who need it most will get help and be able to choose the supports that will work best for their child, such as behavioral services, caregiver capacity building and training, respite services, technology aids, and travel. That's from Lisa MacLeod. And Azed, I couldn't help but hear you snort when I read that.
Coming off a cold right now, but,
Okay.
but there was a snort in there as well.
How come?
Well, look, you know, the issue here for parents, I think, at least for us, and I have a child who's 15, my son Django, so we've been through it, you know, and the issue here is, you know, it all sounds good in a political sense, you know, we're going to help, we're going to get the wait list cleared, but the issue here is that this is not a needs-based plan, right? There's a couple of things here. One is, you know, I really believe, and this is a larger discussion, but I really believe that this is a poor way to distribute the funds through the Ministry of Social Services. This is a medical condition. Autism is a medical condition. Autism is a blanket statement, right? But it's a medical condition. It's a neurodevelopmental disorder, even though it's a controversial term.
Yeah.
So I don't understand why Youth and Social Services is handling this. This is a health issue, and it has been brought forward as a private member's bill in the past. This should be covered by OHIP. And why is it a childhood issue? I mean,
because it doesn't go away.
It doesn't go away when you're 18. Mm-hmm. And you know, other than that, the more important element here is the funding itself doesn't cover anything. It's like saying you go to the doctor, he gives you antibiotics. You got to take 4 a day for a week. Well, you know, instead of that, we're going to give it 1 a day to 4 people for a week. it's not effective. It's not going to work.
That is the basic bottom line here, is that when the Liberals decided to give full court press treatment to whoever they could give it to, the Conservatives are essentially taking the same budget, but they're spreading it out over more people so that more people can get treatment, but not necessarily as intensive as some need, right? That's the bottom line here.
Yeah.
Okay. Hannah, give me your sense about the new announcement and how you think it's working in your situation.
Well, I mean, it won't work in our situation. Our kids won't get funding.
You've got two kids on the spectrum.
We've got 2 kids on the spectrum. Our daughter is out of the major funding gap, but she actually doesn't need that much funding. She needs a little bit of help with some gross motor skills. She may need more stuff in the future, but we don't know.
How old is she?
She is almost 8.
Okay.
And then our almost 4-year-old needs a lot of funding. Like, we're looking at $50,000, $60,000 in therapy. Even if we were to have the maximum amount, we would get 20. And that's only for families earning under 55,000. So they can't make up that difference. They won't be able to use it in a way that the government is aiming for. They're also saying they give us choices, but we've been told speech therapy is not covered, which is a remarkable consideration given it's a communicative disorder for a lot of children. Occupational therapy won't be covered. There's a lot of gross motor and fine motor skill. There's stuff that we can do to help these kids, but they're taking away our choices.
What have you done with your basement?
We took a finished apartment that was going to be for grandparents, and we turned it into an Airbnb.
So you can make some money.
Yeah, so we pay for about half of my son's part-time therapy with that.
Do you think that's the way it ought to be?
No, I would really not like to. I have to go home from work sometimes at lunchtime to clean the apartment to turn it over for the next guests. That's a job and a half. I work full-time. I take care of 2 special needs kids. I shouldn't have to turn my house into, I shouldn't have to rent out empty rooms in my house to give my kids medical treatment.
Tracy, let's talk about this childhood budget of $140,000. How do you see that being dispersed?
Well, I think it's a little misleading, $140,000. It sounded initially like we could work with that as a private provider and for our families, especially when Minister MacLeod talked about front-loading that budget to preschool or early intervention. So that would, the way a behavior analyst would look at it, that would translate to roughly 2 years of full-time, which matches the research, which actually says that that's a really good spend and being fiscally responsible. But what they didn't announce initially was that there's a cap every year as well. So the only families that will actually be entitled to the $140,000 is if your child is diagnosed before the age of 2, you start treatment at 2, you make under minimum wage, both parties, and nothing changes in your family financially until your child reaches 18.
That doesn't sound like it's going to cover very many people.
I would not think it would cover almost anybody in the province. So it really, as the parents have said, it really isn't going to provide any treatment that is meaningful. Respite isn't a treatment for a child. It may be very much needed for families. Totally agree with that, but it's not treatment for a child. Travel isn't treatment for a child. It doesn't. If you're claiming travel, it's not leaving you much for treatment. iPad is not treatment. So really, the only thing left is parent training, which absolutely is treatment. But even that, when you look at the max of up to 20,000 under the age of 6. Or a max of up to 5,000 over the age of 6, it doesn't even give you a lot of money for that.
And let's get you into the discussion. Tell us, first of all, Autistics for Autistics Ontario. What's your group do?
Well, we're a group of autistic Ontarians, and we formed about 15 months ago. We actually formed in response to the Ontario Autism Program because we felt like it didn't address the needs of the community and that it brought into some ideas about autism and autism therapy that are rather old-fashioned. And we wanted to shift the paradigm a little bit and get us talking about how we make autism policy and how autism policy is done and how we approach autism in a different fashion.
And you worry about adults as well, not just kids, is that right?
Yeah.
And adults is part of your mandate.
Yes, definitely.
Yeah, because it isn't obviously for, governments are very much focused right now on the early years. Tell us what you think about the government's announcement and the way they've changed things.
Well, I'm glad that they've scrapped the OAP. And I know that's the Ontario Autism Program, the former program. And I know that's a controversial statement to make in this group, but here I am. And we are glad that they've that they've scrapped that program
Because?
we saw that the way that the money was being distributed was for very expensive, hourly intensive programs for kids, and there was a lot that was left out of the picture in doing that. We also look at other jurisdictions, for example, in the UK, which doesn't recognize ABA and EIBI as scientifically valid. They take a different approach, and the children there aren't receiving the same kind of intensive treatment, and yet kids are doing okay there. So being open to looking at whether it's possible and how it's possible to do autism funding, that's just very different from the way that we've been doing it. I think that's a really refreshing opportunity for us to make change.
Do you want to speak to the criticisms you've heard from the two parents?
Which criticisms, I guess?
Well, take your pick. There have been a few.
I'd like to see people being open to the idea that I know that people who provide a service want to offer a lot of hours of their service. They make more money the more hours that they bill for. And I think it's important to start to look at that service model and what's being left out of that service model in terms of all kinds of services that are not being offered because all of the money is going into these intensive programs. Is that really working? It's really not.
One of the reasons that this has become as big a story as it has become is because the minister responsible, Lisa MacLeod, said some things to some people in a behind closed doors meeting, and I just want to touch on that for a second here. Sheldon, let's bring this up, please. This is from the Toronto Star earlier this month. In a memo to members Wednesday, the board of the Ontario Association for Behavioral Analysts, ONTABA for short, said that, quote, the minister and her staff requested that ONTABA provide a quote of support and indicated that failure to do so would result in, quote, 4 long years for the organization. It went on to say that, quote, the minister also indicated that if a quote of support was not forthcoming, a communication that behavior analysts are self-interested would be released from her office. In spite of the implied risk, the organization refused. One analyst who attended the Jan 29 meeting in advance of the government's autism announcement said it was, quote, more akin to meeting with a mob boss than an elected official. Tracy, you're a member of ONTABA.
Correct.
I'd like to know how you reacted when you heard what Lisa MacLeod said.
I reacted as any professional would react. I think we cannot endorse, as a group of behavior analysts, we couldn't endorse something that we couldn't understand and we didn't have enough information on at the time. So that was one of the biggest problems. The comment about self-interest is a particular interesting one, since no other profession has been labeled as self-interested. And as a credentialed behavior analyst and as a regulated speech pathologist, we are interested in our clients and the best outcomes for our clients. That is what we are supposed to do. We are not self-interested in any way, no more than any doctor who you know, to go back to your example about medical or any medicine, a doctor who may have a cancer patient would say, you know, for your type of cancer, you require 28 units of chemo. You know, that is no different than what behavior analysts do. We actually look per child. We wouldn't get the right outcomes if we took a higher functioning, and that's a controversial term as well, but a child that wouldn't need intensive behavior analysis and tried to do that with them, we wouldn't actually get the outcomes that we would like for that child, and it wouldn't be where we need to spend our time.
I want to get the two parents to react to the Lisa MacLeod quote. Azid, please.
Well, I mean, you know, it speaks to the politicization of this whole issue, right? This is a political move. It has nothing to do with helping our kids. And these kind of strong-arm tactics that we hear about, they kind of reveal that they themselves are not confident in the program. You know, if you're confident in your program, you put it forward and you let people say what they will about it, and you go from there. But you don't strong-arm people into saying, well, you give us a quote, back it up, or else, right? And it's clear that they know it's not going to work, you know. And this gets back to, you know, how we classify autism. You know, first of all, autism is big. It's a spectrum, right? So many different, I mean, I've been around people with autism now for 15 years. I know a lot of different families. I know a lot of different people with autism. Some of them I can have a nice chat with. Others can't speak for themselves. My son can't speak for himself. I have to speak for him. Me and my wife are his voice, right? And I heard somebody else say, parents of kids with autism are professional protesters. And it really bothered me. It's not that we're professional protesters. We don't want to protest. We're tired, right? We work, we both work full-time jobs, and, it's a lot of work to raise a child with autism. Believe me, we'd like nothing better to just sit at home, watch Netflix, and have some snacks, right? But we can't, right? When you can speak for yourself and you can function somewhat well in society, that's one thing. That's one level. I'm not saying you don't need services, you do. But it's different for kids and adults who can't speak for themselves and are not going to be able to ever really function in our society, It's like putting the square peg in the round hole. Yeah.
Hannah, I'm curious as to what your reaction was when you heard that the minister, I guess threatened is the right word, it would be 4 long years for your organization if you don't give us a good quote for what we're doing.
Well, my reaction was I posted that on Twitter. And it kind of blew up because everyone was appalled at what they tried to do. Especially the self-interested in the 4 long years. When our daughter was first diagnosed, we were left floundering because we were on the wait list and we didn't know what to do. So I took her to private clinics and said, she needs help. Let's get her into ABA. And they assessed her and said, no, she doesn't belong in ABA. She doesn't need that help. She needs other things. Here are some other suggestions. To me, that is the opposite of self-interested. And to threaten an organization, again, if you can't show us what the program is and you want to quote, that means either I think they don't actually know what the program is. Like, I think they haven't done their homework. And it's trickling out because they're making it up as they go, or they know it's going to be such garbage that they can't support it.
Well, let me play devil's advocate here for a second. Every minister who makes a new announcement, particularly when the announcement is designed around something as controversial as this subject is, and the issue was controversial before when the Wynne government had it and when the McGuinty government had it, it's always been a very tough file regardless of the minister. Do we have any understanding for a minister who may have used the wrong language, and let's establish the fact that she apologized for having said it, do we have any sympathy for a minister who is trying to put the best face or put the best foot forward on something this controversial? Mark.
I think I'd have to agree with this being a political issue, and thinking about your comments there that this has never been an easy file. I think all of us who've been in this field for many years, the families who have been around so many changes to the autism program, it's a constant series of a revolving door of new things to understand and uptake. So I think for any person in a political leadership position, we would start to say, we would agree that this is not an easy thing. At the same time, I think it's really important that any government really take the time to listen. Listen to families, listen to the professionals.
Do you think they did in this case?
I don't know how fully. I know that some parents were spoken to and some people had an opportunity to hear some information about that.
I mean, theoretically, Amy Fee, who's the parliamentary assistant, has autistic children.
For sure, she would be able to speak to that from a personal story. But I think because of the complexity and the wide range on the autism spectrum, that you really need a wide range of voices. It's actually very interesting to see this crowd sitting here today because there's a wide range of understanding, and that the answers really have to be individually focused. But when you think that way, that means you need a lot of voices together to say, what is a good program that is equitable for what the needs of that child are? And that's a complex thing. It's not a one-stop shop, and it changes over time.
And help us out with some of the background here. I want to go back to the original problem. We said off the top there's more than 20,000 people who are on a wait list to try to be diagnosed in the first place, or not to a wait list for services. Why were there so many families on that wait list to begin with?
Well, you'd have to ask the policymakers about that, but part of the reason is that costs were so high for individual therapy, and the demands for individual therapy required such a huge number of hours. I like, Margaret, I'm going to pivot out what you were saying about consultation. For the last program, the consultation wasn't, in my view, meaningful. in terms of who they consulted. Even the way that they collected data wasn't meaningful. They kind of took data that was given to them by lobbyists. They didn't collect their own data. And in making a new plan, and I think that policy is dynamic. I don't think this is all set in stone. It's going to change. In making a new plan, making new plans in the next 4 years, 8 years, however long they're making these plans, they have an opportunity now to collect their own data, and they have the opportunity to really meaningfully consult, not just with the loudest voices in the lobbies, but with autistic people and autistic organizations with a range of service needs. So I'm hopeful that that will happen.
But part of that is that autism, we keep expanding our understanding of what autism is. You know, you go back 30 years, 40 years, people weren't being diagnosed because the criteria was different, right? So the wait list is partly because of that. We're getting better understanding of how to screen for autism at younger ages, which is all good stuff. The other issue here is that autism is a mysterious condition, right? And the medical community really doesn't have a sense of, they can't just, it's not like other medical diagnoses, you know, here's some pills, here's some therapy, here, you know what, it's therapy based, right? It's behavior. So it's about categorizing it properly, right? And they don't know how to do that because they kind of go, we don't know what this is. Like we've had this, we've had our son for 15 years. We've been through it all, right? And we are still pretty much in the dark in terms of any kind of clear understanding of what's causing this, you know, what, you know, how do you deal with this? You could, you know, they like to throw a lot of medications at you or different therapies. Nobody seems to know. And I think this is a big issue in why there's a big wait list. They blanket solution everything. They just kind of throw some money at you or throw some behavior at you and let's see if that sticks, you know, let's see if this sticks. So they're trying. I think the better approach would be, again, as I said at the beginning, is we need to recategorize autism as a medical condition covered by OHIP. This is a medical issue.
If you did that, if you reclassified this as a medical condition covered by OHIP, basically which means service on demand, the cost of that would be double, if not treble, and this is a government that is trying to save money, not spend more money.
Well, I would disagree with that. I think, again, it's needs-based. I think out of the 20, let's say there's 32,000 or something kids or whatever they say with autism.
I think it's 40,000.
Okay, so a third of those are probably high needs, full service kind of kids, right? It's not like what, you know, the kind of the drama here is that, oh, it's going to cost us so much money. It's going to cost us so much money. I think the money it's going to cost us money regardless. I mean, because what happens to these kids if they don't get the right service is you know, they age out and then they have to be taken care of in another way, in a terrible way, by basically putting them either in institutions or group homes. You're paying for that too, right? What you really want to do is have these kids grow up to be as productive, live a life that's as productive, as dignified, and as safe as possible.
Let me get Ann and then Hannah.
Yes, I'd like to jump in to say that we can't reclassify autism as a medical disorder because the research and scientific community doesn't recognize that autism is a medical disorder because autism isn't a medical disorder. So you would be asking the entire framework for the scientific community to change.
But how do you say it's not a medical disorder?
They don't. It's not a medical disorder.
It's a brain.
It's in the
You're born with it.
It's in the DSM-3. It's not
The diagnostic
yeah.
statistical manual.
It's not a disease. And so, I mean, to totally redo that just here in Ontario wouldn't make sense because that's not how the rest of the world is looking
That's
at
actually
it.
not true. In the United States, for example, 48 of the states do cover through private and public, a mix, right? All the services. It's not true that it's not covered in other places. It is, and I don't have a list in front of me, but it's true. You can reclassify it. It's also come up twice as private members' bills. I think it was Glenn Thibault who did it in 2009. Why it got defeated, I'm not sure. But this is not a new idea, and I think that's a controversial statement that it's not a medical condition.
I think
come
it's
on in here.
controversial to say that it is. That doesn't fit what
You
I
get diagnosed by a doctor.
Here.
Let me get Hannah in here for a second. Go ahead.
Not to speak to this part because that's not my area, but I used to teach operations management, and I love scheduling and lists. And when my daughter was first diagnosed, and then my son, and then my daughter, because my daughter was misdiagnosed, they put them both on the same list, and we had to wait for service. My daughter is there's no, for lack of a better term, high functioning. She does not need to be on the same list for services as my son, who is nonverbal, who has very high needs at this stage. And I was appalled to find out that all of those kids were just on one list, and they were just going down them one by one, and they didn't weed anyone out and say, well, you know what, a little bit of speech, a little bit of OT, and you're good for a few years, come back and talk to us if things progress, and vice versa. Like, it was so badly managed. And
So it's got to be a better way to
interesting-
organize
yeah,
this, you think?
that was the Liberals. And it's funny because the way the statement was read from Lisa MacLeod, everything that they've talked about, they're acting like what we want to do is go back to what the Liberals gave us. And we don't. My son's been on the wait list for half of his life. We don't want to go back to that. We want to make it better. But what they did was, and one of my friends made this analogy for me, they took a coffee cup that had the handle broken off, and they smashed it with a hammer and said, there, we fixed it. And I mean, it's a great time, as Anne said, to re-envision everything, but I certainly don't get the impression that they're going anywhere other than, we're not paying for this.
Well,
You
let's
guys
do
are on
that.
your own.
Tracy,
Maybe you should mortgage your house.
Let's start with that, Tracy. If we're trying to reimagine how this actually could be done better, where would we start?
I think we'd start by actually finding out who is on that wait list, because we do know that of that 23,000, they keep using that number, there are many, many individuals who have already had services. They've already had speech therapy in the 8K funding. They've had OT under the 8K funding that was in the previous government. Many of them have had ABA groups, parent training, and some of them have even had intensive services. So I think, along what you both are saying, and even Anne, we need that 23,000, we need to triage that list and actually figure out who is there and what do they need. And then I really do think that we need to get this out of one ministry and look to see what part is medical, so what part belongs under Ministry of Health, maybe OT, SLP.
Too many acronyms here, Tracy. What are you
Sorry,
talking
speech
about?
pathology, occupational therapy.
Yeah.
Welcome to my world.
Yeah.
We need to look at Ministry of Education, because
Yes.
children spend most of their time there. And we know that it's working in other places better, that they don't require as much intensive behavior support when they're young, because they do get some, the children that need it get it when they're young, but then they go to school, and their school systems are set up to support them in school. They're in school till they're 21. That is a long time to have some really good services. Ministry of Education has not been a player in this game to date.
Does that seem odd to you?
Very odd. We are all waiting.
Let me go to Mark on this then. If you were reimagining a better way to do this, where would you start?
With the very things that Tracy is saying, but the issue about education is a really important one, because I think a program, when you have programs that are in silos and they're not required necessarily to work together or to think about ways to make to share the resources that are there, we have opportunities that we've just not availed ourselves of in the province yet. And right now, for many of the families who have been relying on intensive hours, one of their fears is that if they go to school, that their child is not going to have access to the resources through programs like this within the school setting, where kids are spending most of their day, as Tracy said. So we really need to look at where our kids, and families told us through surveys we've done that they really want to have access to these programs, where the kids spend the majority of their time. And that is school, but also at home and in the community.
Can I build off that really
Sure,
quickly to
go
say
ahead.
the Ontario Human Rights Commission, I don't know if everyone saw the report that they came out with in the fall, but the Ontario Human Rights Commission did a study that showed that special education in Ontario hasn't meaningfully changed in 40 years. Special education in Ontario hasn't meaningfully changed in 40 years. So if we really want to get something going, we need to take it out of one ministry and one portfolio. We all seem to agree on that. And look at how can we make our schools and our special education, which is very much a silo right now, and it's not a pleasant place to be a lot of the time, how can we make it truly inclusive? And these are ideas that we really haven't been exploring in policy.
Mark, can I try this with you? If somehow the budget for this were magically doubled from, I think it's $321 million annually now, to let's just say $750 million a year, is there even enough capacity in the current system to provide the treatment that is needed?
It's not even across the province. So depending on where you live, you may have access to therapists in different communities and in other places where parents don't actually have a choice because there aren't enough therapists in those communities or people who are qualified to provide these services.
So are the colleges training more therapists going forward?
They have been.
They have been.
They have been very much on board about this. We've seen this through many of the programs and training lots of instructor therapists. But they need to work under supervision, and that's an area where we're lacking still in capacity.
What do you want to see at this point? I mean, we are where we are. We have a new minister with a new approach and, many fits and starts along the way to be sure, but we are where we are. So what do you want to see now?
Well, I mean, we've said it time and time again, evidence-based. We don't want the minister to decide what sort of treatment our children get. We want the experts to get it. We want the autistic adults in the room with us to help, because in many ways, they get our kids, they understand our kids so much more than the parents do. Especially, I mean, we're still very new into this, and I spend a lot of time on Twitter actually asking the autistics for advice, and they give phenomenal advice. And they yell at me when I ask the wrong question because they know their stuff. So we want everyone at the table to figure this out. The last system wasn't great.
But they have said this is it.
Yeah.
They have said this is the new program, period, full stop. We are not revisiting this. That's what they've said.
Yeah.
And if that ends up being the case,
then they're going to be a one-term government. Like, this is, I don't think they realize how vocal we are and how good
I think they're finding that out.
autistic parents are, or parents of autistic children, and autistic parents. We are very motivated. And we got the Liberals to change. I'm pretty sure that at some point they will have to come to the table.
I'd like to know, AZ, how much confidence you have in the current Social Services Minister, Lisa MacLeod, to fix this.
Well, I mean, look, I don't know. I don't have a lot of confidence from what I've seen so far. I don't have a lot of confidence in her fixing it. I just think, again, this is a cynical government. I think they're using this as a kind of political statement to say, look, we're clearing the wait list. But you can achieve a result and do a lot more damage than people are really realizing, and it can look good on paper and not be so good. And I think we're going to see the results of this in the next few years if this goes through, and it looks like it will. It's going to be bad. It's going to be bad fallout, because it's true. Parents of kids with autism are fighters.
What's going to happen to your son Django when he turns 18 years old?
Well, he's in Oakwood School right now. So Django was a part of the early TPAS program. Luckily, he got diagnosed early, and that was, I guess that was under the Liberals, right? Yeah. So they had the TPAS program at Surrey Place. He went there till he was 6. At that point, they were saying, after 6, we're not giving you another dime for IBI. They changed that afterwards because of protest. But he went to, luckily, Django got into Beverly School, which is the best school on the planet.
Where's that?
It's on Beverly Street, downtown Toronto. Okay. Best school on the planet. Okay. But not everybody's lucky enough to go to Beverly School, right?
And how long can he stay there?
He stayed there till, so that was like, he was there till he was in grade 8. I guess 3 years ago. Okay. And then he moved to Oakwood. So now he's in Oakwood till 21.
Yeah, I was going to say, at some point he ages out from all this.
He ages out, and then the prognosis doesn't look good for us at that point. We worry a lot. We talk a lot about what are we going to do. And some of it is that parents, and I know other parents who've had to start their own schools, have had to start their own, communities, and we talk about this kind of thing, what are we going to do? When we get older and, there's no programs, the idea of sticking your kid into a group home is just really frightening. And, we're lost. So we're not getting a lot of support from the government on these issues. Right?
I'm literally down to my last 30 seconds here, Marg. I want you to tell us, if in fact Lisa MacLeod stays true to what she said, and this is it, and there are no changes coming forward, what does that portend in your view?
I think it means that some children will not get the services that they need. Many will not get what they need. But others will have money for the first time to spend on some things. And so I think that for some families will be a difference that they've not experienced before. But what I would hope is that they would listen to the data as it rolls out. If this program is going forward as it is, that we have an opportunity to find out what parents are actually waiting for and what they're thinking about spending their money on, and that information will inform the program as it rolls out.
Great. I want to thank all of you for coming in tonight and helping us out with this. You flew all the way in from Ottawa, which we're grateful for as well. Thanks so much, everybody, and good luck to you all.
Thank you.
Thank you.
Thank you.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.